The eye wash station near the laundry, or in the laundry actually, is down the service hall, and there's a sign marking it. And you have to go into the washer and dryer room to get to it. It's behind the door here. When you open the door, it's behind it. Emergency procedures for first aid. If for some reason someone has respiratory problems, we've had a problem with that in the past, that some chemicals got together and made someone very woozy. You remove them to fresh air. You give them artificial respiration if they stop breathing, and CPR if they had no pulse as well as stop breathing. Chemical burn to the skin, you're going to flush it for 15 to 20 minutes. Do not scrub it, just let the water run on it. And then you would cover it with a sterile dressing and wouldn't apply any ointments. Have them go to the ER. But you want to get it flushed first before you go to the ER. It needs to be done right away. A chemical burn to the eye, again, that'd be another 15 minutes. If someone has gone into shock, how are you going to know? They'll be clammy, kind of wet when you touch them, pale. They'll have a rapid faint pulse, and they'll be breathing irregularly. So how do you treat it? You lie the victim quiet and have their feet raised. Also, you place the victim on the side, unless there's a spine or neck injury, and we're going to pretend that she has a spine or neck injury, and cover her enough to maintain her body heat. And you seek medical help for all medical emergencies. So we want you to work safe, be informed, use your protective equipment, and know the emergency procedures. Where do you look for information about first aid if there is a chemical accident? In the material safety data sheet, container chemical was in, PDR, call director of nurses. On the material safety data sheet. You can look on the container first. Where is the eye wash closest to the nurse's station? It's in the shower room.